Hello, this is Herman Oosterwijk. I'm here with Mohamed. Mohamed, tell me a little bit about your background. You have been involved in transcription for quite a while, is that correct? Tell us a little bit.
Yes, actually, I own a medical transcription company.
Okay.
And our main specialty we are working on is radiology transcription. So we are providing now transcription services for teleradiology companies and radiology groups in the US. So this is how basically I got in touch with the teleradiology environment and got introduced to that field and that kind of business in the first place, actually.
And so you're here this week to take a class on PACS and DICOM and 807. Did you feel that it really was needed for you to advance more and understand the technology? And what is your experience?
Yes, actually a lot, because we used to work on PACS system after we started to introduce another kind of service to add that other service to the medical transcription, which was the operation center for the teleradiology company.
Okay.
So we are providing after hours and overnight coverage for teleradiology companies to work in coordination between the teleradiology company and the facilities they are receiving, instead of having the company to hire somebody to work full-time after hours and overnight.
Sure.
So we are making use of the time difference between the Middle East or Egypt and US to provide that kind of service. So by doing that, we got exposed to the PACS system because we deal with it every day. But as users, we receive the images, open them, validate them, and then push them to the workers, to the radiologists. And with some sort of integration between the RIS system and the PACS, they show up in the work list of the RIS at the radiologist side. So that's what we are doing, and we are providing that service for actually 3 teleradiology companies now. So we are dealing with 3 different kinds of PACS, PACS system for 3 teleradiology companies. So when I heard about this course and this seminar, it was really a very good idea to me, because I just want to know what's behind what I'm seeing on as a user on the PACS.
Because I can imagine if there's a problem and you don't understand anything about the architecture, online architecture, the protocols, and even with the images, if something is missing for the image, I can imagine that you could just now open up an image, look at the header, and find out, okay, what's going on? This accession number might be missing, or study description is not correct, so you think that definitely will help you to provide a better service to your customers, is that correct?
Yes, sure, absolutely. Because before, when I have a problem, I just pick up the phone and call the IT or the PACS administrator there. But when you can imagine or can have an idea where the problem is, you will give them a shortcut to solve it. If you don't have the tools, at least should know where to look.
So instead of saying, well, the image doesn't come up, you could say, well, the image doesn't come up because think that this and this might be incorrect.
Yes,
and now
exactly.
Okay.
And actually, the amount of information we have got in that seminar over the past 4 days was really more than enough to a user like me to know what exactly is he dealing with.
Okay. Do you feel that in general in the Middle East there's a lack of training and information, or is it something that is accessible, or will these classes really help to elevate the people here to get to the next level?
Actually, the need for such classes is actually coming from the huge progress and increasing implementation of these systems on the hospitals and facilities. So I think that we are really lacking enough training, enough classes to give people idea about what they are dealing with, because it's a new field, a new system to work with. But actually, I can't imagine how could a radiology department or any radiology facility run without PACS system.
Okay. Okay. Well, thank you very much.
Thank you.